port of New York is wide open, and the streets of New York are full of heroin.
The heroin epidemic in New York City is not a joke. It is definitely on a much larger proportion than it was during the 60s. Something has to be done about it.
Heroin addiction, heroin trafficking is probably the single most important criminal problem that we have in good parts of the United States. There is no doubt that there is a total commitment on the part of this administration to deal with that and to deal with it effectively.
Is the problem solvable?
So right now we're doing hazardous waste cleanup. We go around, we pick up all the syringes that we see in the parks. Mike does this twice a week in Washington Heights. We also have a few other locations in the Bronx, and we just come out here and just try to clean up anything sharp with blood. We also try to connect to the participants that we see out here and do outreach. We have our Narcan on us, fentanyl test strips. We just try to give people whatever they need. We have clean syringes, clean stems, just clean supplies.
My son Harris died when he was 19, and he had something called co-occurring disorders. It's the relationship between mental health challenges and substance misuse. So Harris was diagnosed with an anxiety disorder when he was 3, and then he was diagnosed with ADHD when he was in 8th grade. So his path to substance use was really one that was tied to self-medication. You know, oftentimes in rehab, they would talk about, think about life before the substances. And for Harris and for so many other young people, his brain was always working 1,000,000 miles an hour. He was never comfortable in his own skin. And Harris went into rehab and failed on the mental health piece. If you just deal with the substances and you take them away and you're left with maybe a mental health issue or trauma or, a traumatic brain injury, and you're not addressing it at the same time, the likelihood that you can sustain recovery is much lower.
The use of drugs, especially among the young, continues to be a scourge of our society. No venom could be more deadly than drug addiction.
Nixon declared war on drugs in 1973. Then Reagan intensified that in the 80s. Basically, it's been sort of a ever upward ratcheting of longer sentences, more punishment, more police. And really within the last 10 years or so, there's been somewhat of a rethink of that, and yet almost all of our resources are still focused on enforcement. People tend to think that the FDA or some scientific commission sat down one day and said, alcohol and tobacco, those drugs should be legal and everything else should be illegal because science. And that is not what happened at all. Basically, we had a series of panics that were stirred up by people typically with racist or anti-immigrant motivations. And that's how we got where we are. Because if you were going to try to create a rational drug policy, nobody would do what we do.
Many addicts come from teeming slum areas where human misery runs high. Wherever there is a troubled personality, no matter how hidden or unrecognized, there may be a seedbed for drug addiction.
President Trump's opioid commission, their overall message on this is that drugs are immoral, they're used by losers, they're used by the kind of people that we don't like. Let's target them.
People who drift aimlessly through life, robbed by drugs of the opportunity to become equipped to meet society's demands, are casualties.
Addiction is defined by psychiatry as compulsive drug use that occurs despite negative consequences. And our entire drug policy is basically, let's create negative consequences for people with addiction. Well, by definition, they don't respond to that. Like, why would that be a good idea?
You need a different model. If somebody grew up in an abusive household and they have trauma and they're turning to substance use, you don't treat them the same way. For somebody who remembers life before substances and that life was an easy, regular, happy life, but they got their wisdom teeth pulled and they became addicted to opioids, you shouldn't be treating them the same way. Truly mapping this out will create a treatment plan designed to meet the needs of everyone.
On a local level, one thing I'd really like to see is just more expansion of just education, proper education about OD prevention, OD intervention. We try to provide all these community naloxone training twice a week and try to give anyone who can the opportunity to learn how to save a life.
Right here is all the information that you need. So I want you guys to review it. It's going to show you everything. If you suspect an overdose, give them this. It's not going to harm them. It's perfectly legal for you to have this because Samaritan law protects you from any kind of harassment or any kind of arrest based on the fact that you use this. The only concern should be that you save somebody's life.
Our drug policy really hasn't been about reducing harm linked to drugs. It's not about locking them up, putting them in cages. We need to help them.